So this is the 10th module in this course, the cancer course, that I decided to put together for cancer patients and cancer carers and really anyone affected by cancer. And this course is all about facts and details and reality. It's not about awareness or anything like that. I don't see a lot of value in that kind of thing. So this topic is about physical and mental health when dealing with cancer. And on one level, we could say a really good way to stay physically and mentally healthy is to avoid the big three of cancer, which is surgery, radiotherapy, and chemotherapy. But that's not reality really for any of us. We have to deal with cancer itself, the impact of cancer itself, and really impact of treatment. Whether the treatment goes well or not, it has a lot of impact on us. So I'm going to talk about physical health first, because physical health is really kind of foundational for mental health. I discovered that quite early on. I was obviously devastated to be given a terminal diagnosis at the age of 36. And yeah, I suffered a lot mentally, but quite quickly I worked out at least part of it was things like just exhaustion, like just physical exhaustion from having had a huge surgery and being on a brutal chemo cocktail that I really struggled with, and all the time spent in and out of hospital and that kind of thing. It's just physically exhausting. Not sleeping much at all, and therefore just not being in any fit state to like deal with day-to-day life. So what I kept thinking were kind of mental issues of like depression and stress and trauma. Quite a lot of that was consequence of physical stuff, and physical stuff tends to be much easier to fix directly. So yeah, it's easier to get yourself physically well, even when dealing with chemo or aftermath of surgery. So I'm going to just go over some of the stuff I've learned about physical health. First thing is it's really important to keep some kind of diary or journal of what's happening and what you're doing. And this is something that you might want a family member to help with as well, because things like if you're struggling to eat, I found just like writing down everything that I was eating, and that's something I still continued for like now 6.5 years later. When you're struggling to get food down and to keep food down, that really, really helps. And noting things like your weight weekly is really important, because about half of people with cancer at some point are going to get some level of something called cancer cachexia, which is like weight loss, either cancer induced or cancer related, or particularly chemotherapy induced. And it can be difficult to spot, because you might be losing weight because you're not eating, and that's not the same as cancer cachexia. Or you might be eating but not keeping food down, and then again, that's very natural that you would lose weight. But cancer cachexia is like when you're eating, you're getting the calories, but you're losing weight and you're losing muscle. And it's something that is poorly recognized. Like everyone in the medical world knows it's a big issue for cancer patients, but it's really not well monitored. So you have to watch out for it and get family members to watch out for it as well. So yeah, the diary or journal is very, very useful to make sure that you're eating enough and well enough and regularly enough, and that you're staying active. So it's very, very easy to kind of get lost, particularly during chemo, particularly like in my situation where we're still on chemo for life. And yeah, very, very easy for days to pass without moving much. And then particularly males tend to lose muscle very quickly when we're inactive. So this is stuff you really have to watch out for. But also on a much more positive note, you can, by logging what you're doing, you can make some progress and you can see some progress. So being able to do, get a bit fitter and healthier and stronger over time, even during heavy treatment. Yeah, what gets recorded gets improved. So yeah, that's like a foundational thing. It really, really makes sense if you can afford it to see a sports physiotherapist. I do not have a high opinion of non-sports physiotherapists because it's just so different. Like the physiotherapist that you get to see at a hospital, they have very, very low expectations. And I've just found sports physiotherapists are just another level. And a really good physiotherapist, you'll see them maybe every few weeks if you can afford it, and they'll give you stuff to do. So they'll do a bit of stuff with you, maybe some kind of sports massage. If you've done like radiotherapy, you might have like your arms behind your head for kind of 20-30 minutes at a time every day for a few weeks during radiotherapy. I did proton beam therapy where I had 8 weeks, 5 times a day, and because of where the target, arms behind my head, yeah, very, very uncomfortable, very quickly. Physiotherapy helped with that so much. And when I later did another type of radiotherapy, I knew I was going to be in an uncomfortable position, and I went to see a sports physiotherapist, and they gave me a bunch of exercises to make the that position much more comfortable. And it was, yeah, so different. So a good sports physiotherapist will give you like functional tests. So functional fitness is fitness that relates to like practical movements you might do. So in daily life, we might pick up something from the floor and reach with it up above our head to put it in a cupboard, or you might grab a small child and twist and pass them to the partner or whatever. So these kind of functional movements. So yeah, sports physiotherapy really focuses on that kind of thing, and they're very results driven. And yeah, I've just found it's absolutely life changing. It's helped me deal with lots of stuff. And good sports physiotherapists will ask you to like video them doing the exercises that you then have to do at home. So it's really handy. Make sure you've got a phone or camera with you charged up. They'll typically give you like seven or 8 exercises and say do these every day or every other day, and come back and see me in a few weeks. It's really important with physical fitness to concentrate on strength first. That's like the first thing that goes with inactivity. And it's quite frightening as a cancer patient, particularly if you've had a big surgery or you're on chemo. It's quite disorientating and shocking when you suddenly can't do things that were quite easy a short time before. And particularly if you're older, falling over and stuff is really quite serious and unpleasant. So you want to avoid that, and yeah, getting some strength in your body makes a big difference. There are loads of YouTube videos on functional fitness stuff. Typically you'll use like exercise band stuff, sometimes called like TheraBand, this kind of stretchy stuff. Another thing I found massively helpful is those ankle weights. So like walking up and down the hill. If you're going to do surgery, it makes a really, really big difference preparing for the surgery. I was actually kind of surprised by this talking to surgeons, but even just, if you're booked in for surgery in 3 weeks' time, then 3 weeks of exercise still makes a big difference, whatever you can manage. Yeah, I'd have thought surgeons would say, "Oh, you've got 3 weeks, don't bother." But no, it's quite significant. I had big surgery a year and a bit ago, which was abdominal surgery. This was reconnecting my intestines, and being male, we have quite like narrow pelvis, so there's not a lot of room for kind of poking around in there, and our organs are covered in protective fat, and losing a bit of weight kind of shrinks some of that fat, and that gives the surgeon a lot more room. And because my surgery is like a difficult, dangerous one, because my reconnection point for the intestines is really low in my case, any extra space is like really, really beneficial. So I did kind of exercise, diet, and lost some weight. I wish that I had known that for fat inside your body, that responds much better to exercise than to diet. So I was like kind of diligently dieting and doing some exercise, but mainly, eating less. And that would, it still help, but it would have been much better to just really focus on exercise. Doctors generally don't believe patients can like make a big difference to their health by exercise and diet, and I think doctors are generally right on that. But we have to be the exception, right? So if 98% of people are unable to exercise regularly during chemo, we have to be the 2% who find a way. So I found that like alternating between like strength and kind of mobility stuff really helps. So like one day do strength stuff, next day do mobility stuff. Because chemo and surgery and radiotherapy tends to like tighten up our body a lot. We're often in odd positions, or with chemo you might be stuck in bed a lot. Obviously after surgery you're not in a great way. So really working on the mobility stuff, and things like balance as well. If you experienced a lot of chemo, you're familiar with like the peripheral nerve damage. So in your arms and in your legs, and those long nerves, you get nerve damage from chemo, which is very, very unpleasant. And you lose balance, you drop stuff. That's again quite distressing. And you can mitigate that to some extent through exercise. General like stuff where you're moving your arms through the full range of motion seems to help with peripheral nerve damage a little bit. With like injury induced nerve damage, it helps really, really well. Your nerves in fact start to like heal after 24 hours. With chemotherapy induced nerve damage, it seems to be less effective, but does make a difference. Another big thing I found with the physical health is that just trying to maintain your physical health is not enough and is not motivating. Like instead, focusing on like increasing your ability is really helpful. So like being able to do more and enjoy more of your life, I found that far more effective and far more motivating than trying to like just maintain my current level. And yeah, a big thing to work on is grip strength, because that's one of the first things that goes. And yeah, I know I keep saying it's distressing, but yeah, I found it particularly distressing, and quite easy to fix. So you can do things like get just thick rubber bands, or you can buy proper like bands for your fingers where you put the band around and like force your hand open. You can get those hand grip things. These are not great. They're okay, but it's not very close to like a real gripping action. So kind of balls that you squeeze are better. But again, sports physiotherapist will recommend a lot of that kind of stuff. Another thing they might recommend, if you've got aches and pain, well, when you have aches and pains and nerve damage and things, stuff like a foam roller, or a hardish ball like a lacrosse ball is ideal, where you can use that to like relax some of those tight muscles. Another thing, obviously foundational to health, is our diet. Now this shouldn't be controversial, but actually like the medical evidence about diet and for cancer patients is actually very compelling. And that is that how much you eat is a lot more important than what you eat. I know everyone has, and it's a very personal topic about what's healthy and what's not healthy and stuff. But the really big thing is to keep eating. In digestive cancers, for example, it seems to make a massive difference, to the extent that the top GI surgeon in Japan observed that he had never lost a patient to bowel cancer during a period of weight gain. That it was such a big deal that if you can, and he wasn't talking about his weight gain, it wasn't like he was getting really huge, talk about patients' weight gain. And I've talked to a lot of chemo nurses who have looked after patients for many, many years. And their basic advice to cancer patients is eat what you can manage, as much as you can manage, when you can manage. Obviously, I'm talking about real food, not like super processed food, although if that's all you can manage, then yeah, better than nothing. One of the things that cancer patients often use is a nutritional drink called Ensure. This is a commercial product, but is available in many public healthcare systems as well. This, yeah, was maybe a big factor in me staying alive after my first big surgery. There are 3 versions of it. There's like a milkshake kind of version in little plastic bottles. There's a version in cans, and there's a version as a powder. The one in bottles is considerably better. The powder one is really nasty. When you're on chemo, or in fact just after surgery, like you often have taste changes and like odd stuff going on in your mouth. So it's really important with food to try a selection of stuff and try not to be upset if some of your favorite food suddenly tastes revolting. That changes over time. That ebbs and flows as well. So like something that you can't manage today, maybe you can manage it in a few days' time. But stick at it and keep your notes. But yeah, the evidence for eating as a cancer patient is really quite strong. It's not like a gray area. It's quite strong that the really, really, really key thing is to keep eating and keep exercising and try to not to lose the muscle mass. For at least for the big 3 treatments of surgery, chemo, and radiotherapy, the biggest deciding factor of outcome is what people call performance status, which is like just your physical wellness. So patients who are physically quite well tend to get better results from those treatments. And I've particularly found that a lot with immunotherapy, and talking to my immunotherapist a lot about this. A big factor he notices is that patients who are physically well, yeah, they get a better result. And of course, there's like correlation and causation there as well. It's not a simple thing. Yeah, patients with more disease burden are suffering from more immunosuppression, for example. So it is a complex thing, but it's definitely a very clear thing. Two other very I guess obvious things, but as cancer patients, we have compromised immune systems, so it makes sense to get extra vaccines that are available to you. I would have never considered getting a flu vaccine, but I now get it every year, and it's amazing not getting flu. I'm in Japan, where we have very narrow flu strains, so the vaccine is particularly effective. I know in some countries there's a lot more variety and the vaccine is not so effective. Kind of on a weird related thing, first two big surgeries I had for cancer, I got pneumonia, like post-surgical pneumonia. And like the third time I went to do the surgery, I just said like, oh, would it be worth having a pneumonia vaccine? And the doctors are like umming and ahhing, and yeah, it's not covered by public insurance in Japan, but might be useful. So I had it, and of course, no pneumonia, and that made recovery much more pleasant, because when I did liver surgery and got pneumonia, I got collapsed lung as well. Not nice, and would have been completely not completely avoidable, but the pneumonia vaccine is 60% effective. So yeah, it was really worth having. I'm going to briefly go over some mental health stuff that I have found and I have observed. As I said, like physical health seems to make a big difference, particularly with things like decision making. So as cancer patients, we often have to make very serious decisions, and if you're in poor physical health, that's kind of difficult. But even then, you should try and make those decisions when you're feeling your best. And there's this handy acronym, HALT, HALT, that says we should try not to make decisions when we are hungry, angry, lonely, or tired. And as a cancer patient, you often these four things at once. So it's not a good time to make decisions. It's always good to think about stuff, write stuff down, come back to it, and make the decision when you're in a better frame of mind to do so. Some of the challenges we have as cancer patients that take a big mental toll on us. One of the things I found a lot is wasting time, and like the feeling that I'm wasting time. We have great public health in Japan, but it often involves a lot of like waiting in hospital, like waiting 30 minutes or an hour to see someone. So yeah, I found that really stressful and frustrating. So now I'm always prepared to make the best of use of time. And one of the things I found is spend that time studying something that you're interested in, or in my case, obviously studying cancer. But studying something, I just find it really, it feels very different afterwards. So if you were sat waiting an hour in hospital, waiting to see the surgeon to talk about your surgery next month or whatever, if you spent an hour actually studying something useful or something that you're personally interested in, you can feel kind of quite good afterwards. Whereas if you just sat there frustrated or playing games on your phone or whatever, kind of filling time, um, you feel kind of, or in my case, feel kind of bitter and frustrated. Um, Another thing I found to use that time well, if you got phone with you, is writing nice emails to people that you care about, checking in on other people. I found that really helps. Um, Another big thing we deal with a lot is depression, particularly when we're tired, and particularly when our situation is very grim, which mine was, and you know, one could say still is. Um, I found a very, very obvious way out of that is just help other people. I've found that just so powerful. Um, just I try and ignore how I'm feeling, take some action to help other people, and things just, yeah, seem better. So as cancer patients, we know what other cancer patients need, so it's quite and there's a lot of stuff you can do online. I spend quite a bit of time in various online groups, just helping out people, just answering questions when people are asking questions about different treatments, or maybe someone's new to cancer. Or I also try and help out carers a lot, because caring for people with cancer is really, really tough. So yeah, I try and help with that as well. Explain to the carers what their family member or friend or whatever is going through, and what kind of things are helpful. Fundraising is really good. I personally think it's not so good to fundraise for cancer charities, because yeah, it's much better to help fundraise for patients directly, particularly I think for kids. There are, yeah, lots of ways that you can, again, just like posting stuff online, sharing people's fundraisers, that kind of thing. I personally do not think it's helpful to fundraise for cancer charities, because a lot of that money goes on things that have been proven over time not to be effective, like awareness raising or salaries. um so much better to help people directly. Another huge thing you can do to um deal with your depression is give other people your time and attention, particularly other cancer patients. Cancer can be very lonely, very, very hard to deal with, and just giving, other patients your time and attention, um, I find very, very powerful, and very helpful for me. Another, I guess, obvious thing is like creating stuff instead of consuming it. So if you are interested in taking photos and sharing them online, or writing stuff, or that kind of thing, is just so much more rewarding than consuming things. Interestingly, when you have cancer, like a lot of people think you must have a lot of time on your hands, and are like saying, oh, I've got, I'll get you some books, or you must watch this box set of DVDs. So you spend quite a lot of time trying to explain to people that you're extremely busy, because you have cancer to deal with, and hospital appointments, and finding new treatments, and maybe raising money for your own treatment, all this kind of thing. I've seen lots of people talk about bucket lists, things that they want to do with whatever time they have remaining. I personally have never observed anything good coming of this at all. I have found personally, and I've noticed that kind of we think doing like big things is like going to make really powerful memories or whatever. But yeah, my experience and what I've observed is quite the opposite, that just spending time with people you care about, especially making stuff together, doing things together, creating things together is far, far, far more significant than going to the Grand Canyon or whatever. Easy for me to say because I've been to the Grand Canyon, but yeah, still spending good time with people you care about is much, much better than having a checklist of things you want to do. I think, of course, that's very personal. Another big thing we have to deal with is like managing our own expectations, managing expectations of people around us, dealing with false hope. And I think a big part of that is we have to recognize our own bias and the biases in other people. Humans, unfortunately, when we hear big claims about something, instead of ignoring it completely, which is the sensible thing to do, what our brain tends to do is cut it down to size. So we hear about some miracle cure and we think, of course, that is unlikely to be a miracle cure. However, it probably helps a bit, even when there's no evidence for this at all. So recognizing that and ignoring it is really important so that we're not full of false hope. Remembering that most people are wrong about most stuff. Most people just don't understand anything that they hear or read or are exposed to. And then they share that with us and say, stop all those stupid cancer treatments. You just need a green smoothie once a day and you'll be fine. Or whatever. So getting kind of good at politely rejecting that, yeah, is an important life skill. So dealing with unwanted advice. So yeah, that is like a roller coaster ride through physical and mental health as a cancer patient. I hope, yeah, it was of use to you. This is a topic that I'm going to revisit in upcoming sections of this course. So although this is the 10th of the 10 topics, I'll be doing a couple more sessions on each topic, revisiting them and going over things in more detail. So yeah, I hope that was useful to you.